Are you ready for the most extreme blackhead popping videos you've ever seen? If so, you're in for a real treat. From giant cystic acne blackheads to milia and tiny whiteheads, we'll be taking a deep dive into the world of extreme blackhead popping. Prepare yourself for some of the craziest, most satisfying blackhead popping videos you've ever seen. So, get ready for some extreme blackhead popping. A warning. Before we get into the details of blackhead and milia popping videos, it's important to understand the potential risks associated with these videos. It's not recommended to try any of these techniques at home without proper medical training. In some cases, DIY blackhead popping can lead to skin irritation and permanent damage. Additionally, you run the risk of infection, which can be very serious and hard to treat. If you are interested in this content, please consult a professional before attempting any at-home procedures. Deep blackheads. Deep blackheads are a type of acne that develops when the pore becomes clogged with oil and dead skin cells. The blackhead forms when the contents of the pore oxidize, turning them dark in color. Deep blackheads can be difficult to remove due to their size and depth. Most deep blackheads will require specialized facial treatment. Depending on the severity of your blackheads, your doctor may recommend a combination of extractions, chemical peels, and/or laser treatments. Extractions involve using a sterile lancet to open up the pore and gently remove the trapped debris. Chemical peels help dissolve the dead skin cells that are clogging the pores, while laser treatments can be used to reduce inflammation and stimulate the production of collagen and elastin in the skin. It is important to note that deep blackheads should not be picked or squeezed at home, as this can lead to infection or scarring. It is best to leave it to the professionals to safely and effectively remove your blackheads. Milia. Milia, also known as oil seeds, are small, white bumps found around the eyes, nose, and cheeks. They're caused by trapped keratin under the skin's surface, and they're often mistaken for acne. Milia are most common in newborns and babies due to immature oil glands, but they can also occur in adults. Unfortunately, milia are not something you can pop like a pimple, and it can be tricky to get rid of them. There are two common types of milia: primary milia, which form when dead skin cells don't shed properly and are trapped in a small cyst beneath the skin, and secondary milia, which result from skin damage caused by rashes, burns, or long-term use of topical steroid creams. If you have milia, your doctor or dermatologist may recommend topical retinoids, gentle exfoliation, chemical peels, or laser treatments. All of these treatments can help remove the trapped keratin and reduce the size of the milia. However, it's important to talk to your doctor before trying any treatments to make sure they're safe and effective for your particular case. Cystic acne. Cystic acne is an extreme form of acne that can cause pain, swelling, and deep, red bumps on the skin. It can be extremely difficult to treat, as it usually goes deeper than just the surface layer of skin. While blackheads and milia are visible and can often be extracted, cystic acne is much more stubborn. Cystic acne is caused by a combination of factors, such as excessive oil production, hormones, stress, and bacteria. It is important to note that cystic acne will not respond to home remedies or over-the-counter medications. Treatment of cystic acne requires the use of prescription antibiotics or topical treatments, such as retin-A, benzoyl peroxide, or salicylic acid. When it comes to extracting cystic acne, it is important to note that popping it yourself is not recommended. The pressure from squeezing it can cause infection, as well as scarring. The best way to treat cystic acne is to see a dermatologist who can prescribe the right treatment. In some cases, cystic acne may need to be injected with cortisone to reduce inflammation and swelling. When dealing with cystic acne, it is important to remember that while it can be painful and frustrating, it is treatable. By following the advice of a dermatologist, you can take steps to reduce inflammation and improve your skin's overall health.